Hello everyone, this is Dr. Nasser, and in this clip, I would like to tell you about acute lymphoblastic leukemia, also known as ALL. ALL is the most common cause of cancer among young children, usually younger than the age of 5. It's genetically has been identified to have many sources. One of the most common genetic mutations in ALL is translocation 1221. But also there are translocations 119 that has been seen, and in the adult form of ALL, translocation 922, which is a very famous translocation, also known as Philadelphia chromosome. It has been seen in adult ALLs. This is low magnification, so the magnification is about 250x, and at the first glance you should realize that there are simply too many white blood cells. I do not advise you to try to identify cells at this low magnification. Go higher and then be certain. So in here I simply see two important things. One is that the white blood cells are increased, and then I see also the presence of ROLU. That is an interesting observation in this case as well, because you can see ROLU in ALL. So allow me to go to higher magnification. I see about 4 white blood cells in here. And these two cells, I think they're distorted. There is no cytoplasm, and I do not like to identify cells simply based on their one characteristic. I like to be able to see cytoplasm. However, this cell down here looks like a lymphocyte. This cell up here also looks like a lymphocyte. But notice the difference in size. This is a huge cell. The nucleus of this cell is 2.5 times of the nucleus of a red blood cell. And that's a big cell. I also note the pattern in the chromatin is diffuse, and I clearly can see a nucleolus in this area, another one perhaps in here, another one perhaps in here. So this cell is referred to as a blast. To be very accurate, it is a lymphoblast, but in hematology, in clinical laboratory, we don't report the exact nature of the blast because blasts from different lineages are going to be sometimes look very similar, and we just don't want to rely on that much on the personal judgment. You have to have standards, you have to have criteria, and in this case we refer to this as a blast, but it's from lymphoid family. And I continue to look at other cells in the field, and I notice a neutrophil, a segmented neutrophil in here. Another cell that is similar like that large lymphocyte with the nucleolus in this area, scant basophilic cytoplasm. There's a kind of curvature in the nucleus of some of these cells, abnormal cells. Cytoplasm is scant and basophilia. This white area that you can see here is where the Golgi apparatus of this cell is located, and Golgi doesn't take up the stain, so it might be slightly lighter in this area. So I do see ROLU, at least 1 plus ROLU. I do see perhaps slight thrombocytopenia. I think that the number of the platelets, I do see 1 here, 2, 3, 4, and 5. This is an artifact on the camera. So these blasts are the common feature of ALL. In here you see another lymphoblast. So lymphoblasts in general, they appear 2 different types. Sometimes lymphoblasts can be large, like the previous cell. Sometimes the lymphoblast can be smaller in size, but they are going to be much larger than the resting lymphocyte. Their nucleus is going to be 1.5 times the size of a red blood cell. So be aware of that. You don't always expect one type. And there is a feature that you see on acute myeloid leukemia, and that is the presence of R-rods. In this case, in ALL, you will never see R-rods. R-rods should be only referred to association with acute myelocytic leukemia, or AML. There's a cell in here, it appears to me a neutrophil that is phagocytosing something. It is very active. It has toxic granulation, vacuoles inside of it, and a cell that is fighting its way. So it is the body's immune system is very active. As I go through the field, I see the same pattern of cells repeated. I see these lymphocyte-looking cells with a very unique nuclear morphology. The chromatin pattern. This cell down here looks like a lymphocyte, even though it looks like a resting lymphocyte in its appearance, but not in its size. If you look at the pattern of the chromatin in this cell and the pattern of the chromatin in this cell, this is a lymphoblast. This is a blast. Now, it is very difficult to identify this one. However, the presence of this is going to indicate that these cells are going to be also seen in the blood film. So remember, ALL, acute lymphocytic or lymphoblastic leukemia, occurs very often among young children. There are many translocations known, among which in adults 922 is going to be one of them, and it has a very bad prognosis. However, there are other translocations. One is 1221 that is seen among young children ages less than 5, and they have much better prognosis.